There's a risk of about 0.5% of fibroids being cancerous, and what they usually are is what's called a uterine sarcoma. It's a very aggressive cancer. Unfortunately, it's difficult to diagnose preoperatively, so a lot of times we don't know that's what it is until we get in and get a tissue sample. Laparoscopically, to remove fibroids, we go in with scope and with several instruments, make an incision in the serosa of the uterus, tissue that envelops the uterus, go in and dissect out the fibroid, and again we use laparoscopic instruments to sew the uterus back together where the fibroid was situated. The advantage to doing these robotically is it's one step further than laparoscopy. Robotic instruments allow us to have one more degree of freedom. Laparoscopic instruments can be pushed and pulled and rotated and turned. The robotic instruments have a wrist, so it allows you to have a little more flexibility. It's easier to sew with the robotic instruments, so it's really added some flexibility to the myomectomy. So the decision is one that is made with the physician and the patient to decide what the best approach would be. Oftentimes when women want a myomectomy, they want fertility, so we do a little tubal dye test as well. We push some dye through the tubes to make sure that the fibroids are not obstructing the tubes, which is important. So laparoscopic and robotic recoveries are faster, less pain, there's usually less blood loss, there's usually less risk of infection. If we can do things laparoscopically 2 weeks, most folks are back up to 100% of their daily activity. If we do it abdominally, depending on the size of the incision, it may be a 4 to 6 week recovery.